So you're dealing with low back pain right now. What happens when you go to a physical therapist and get evaluated? A lot of people don't know what to expect when seeing a physical therapist for low back pain. So what I'm going to do is make a video series on how I typically approach treatment of low back pain when patients come to see me in the clinic. Hey, what's up everyone? My name is Nick Helton and I'm a physical therapist. I typically make Instagram videos describing how to exercise, how to move, how to be active. And right now what I want to try to focus on is some more long form content. Do me a quick favor and hit that like button for the YouTube algorithm. I really appreciate it. And it also helps me to make more of these videos if you're interested in that. Now that we got that out of the way, let's talk about the physical therapy evaluation of the spine. This video is number 3 in the series. I've already made parts 1 and 2 dealing with the subjective and objective portion, which you can find in a playlist that I've created below. The evaluation process can be oversimplified into essentially 4 phases. The first being the subjective or history taking, the second being the objective or the test and measure section, the next being the assessment or your sort of professional opinion as to what you think is going on, and then the plan as to what you think we should be doing going forward. So now what I want to do is jump into the assessment portion of the evaluation and discuss how I typically run through an assessment. The assessment portion of the evaluation is where the clinician takes all of the information and all of the data from the subjective and objective portion and comes up with a hypothesis as to what is going on. Sometimes this can be very specific. For example, when seeing a patient with an acute trauma and positive testing indicating an ACL tear. But more often than not, I would say that the assessment on low back pain should focus typically on ruling out red flags. Discussion of regression to the mean, improvement with time, and identifying barriers that need to be addressed for that given individual are much more important. So let's take this very specific example. Client A only has low back pain when they lift up their child from the floor, where client B has back pain when they sit greater than an hour, stand greater than 30 minutes, or walk greater than 15 minutes. The above parameters help us define what the person's individual barriers are, and then we can go about problem solving all of those barriers as we go along. In general, I try to identify, assess, and then engineer solutions. For client A specifically, this could be a simple discussion of other ways to lift the child, simplifying body mechanics, or limiting the overall volume or exposure to lifting items off the floor or the child in this specific case. For client B, this could be as complex as keeping an activity journal or activity log, trying to regress volume of activity in the short term, and slowly titrating up to individual level of tolerance. Other modifications include increasing frequency but reducing the duration, spreading out volume more evenly throughout the week, or substituting in similar activities that have less of an effect on the person's overall symptoms, which could be less provocative in general. The assessment of the individual should contain elements of evidence-informed practice, clinical experience, as well as patient preferences. Combining all of the above gives an outcome that is hopefully tailored to the individual. Based on all of the above, hopefully that gives you some insight as to why asking a physical therapist, what should I do for my low back pain, is really not just a simple answer. There is no magical advice that helps everyone. And really the best advice I can give you in general is to try to be active, avoid complete bed rest, and in general, discuss your symptoms with your healthcare provider. For a great resource on how to stay active, check out the Physical Activity Guidelines for Healthy Americans 2018. I'm going to directly quote the article. For substantial health benefits, adults should do at least 150 minutes, which is 2.5 hours, to 300 minutes, 5 hours a week of moderate intensity, or 75 minutes up to 150 minutes, which is 2.5 hours a week, of vigorous intensity aerobic physical activity, or an equivalent combination of moderate and vigorous intensity aerobic activity. Adults should also perform muscle strengthening activities of moderate or greater than moderate intensity that involve all major muscle groups on a 2 or more days a week basis, as these activities provide additional health benefits. So just remember this, that recommendation is the bare minimum. I'd highly recommend checking out the PDF or reading through the entire description. It is free access. It is from the US Department of Health and Human Services. So definitely check that out, link below. During the assessment, I believe it's important to have an open conversation about expectations, beliefs, and in general, my recommendations as to what I believe is going on. I fully understand how difficult behavior change can be, but I think as a physical therapist, I sort of have a unique opportunity to discuss the importance of exercise, especially to populations that may not be active whatsoever. Now that I've had an open discussion with the patient on the findings and my opinion of those findings, it's time to discuss the prognosis. Think of the prognosis like a forecast. It's what I think will be the likely course of outcome based on the individual findings. And really, here's the great news. Most episodes of low back pain tend to improve with time. The majority of cases are also non-serious, non-life-threatening. Now, that's not to say that low back pain isn't challenging to deal with. That's also not to say that low back pain doesn't have a massive effect on our individual lives. And that's not to say that some cases of low back pain are not serious. It's just to say that the odds are ever in your favor. All terrible jokes aside, the assessment is really important for you as the patient. This is where you can learn more about the why. Use this as an opportunity to understand what your provider thinks is going to happen with your low back pain, or what your provider thinks is going on with your low back pain. It's also okay to not have all the answers. Personally, I always respect honesty from healthcare providers. A statement like, from what I can see, we have ruled out all the red flags. You don't have any major neurologic symptoms that are of concern. This seems like a case of non-specific low back pain to me. In my opinion, you shouldn't walk out of a clinic and an evaluation from a physical therapist feeling more broken than when you came in. That just shouldn't be how these evaluations are structured. I fully believe that we should be highlighting the good things that we find in the evaluation. What are the person's strengths? What things can they do really well? How well do they move in certain positions? But also discussing the things that could be better, not through the lens of you're broken or you need to be fixed, but these are things that specifically that I think you should be working on. These could be things such as range of motion, strength, or specific movements. Let's try and find ways that we can get you to perform those activities in a better fashion. That could be more range of motion, that could be less pain, less symptoms, or that could be more frequency. All of those things really apply in this specific case. The reason I mention that, and the reason I think that that's important, is I hear all too often from patients that they came out of an evaluation or they came out of a visit and they feel worse than when they went in. And it's because maybe they heard, oh, you move very badly, you're weak here, or your range of motion is poor. And while some of these findings might be occurring, I don't think we need to highlight them in such a fashion that it is the focal point of the entire evaluation. And I'm also a firm believer that words really matter here. I prefer not to say things like you have a terrible scapula, or your spine is out of alignment, or your bones are somehow misaligned, because these terms, these thought processes are sort of a thought virus, because people hear that and they think, oh, my spine is broken, oh, my spine is out of alignment, or I need this specific thing to fix me or to align me, when in reality that's not supported by any kind of evidence or anything out there that can be of benefit to the individual. That line of thinking tends to correspond with the I'm broken, fix me mentality versus the I already have all of the things that I need to do. I just need to learn from a professional how to implement those things and how to get back to doing the things that I want to do by removing individual barriers like I discussed before. All right, I know most people probably won't do this, but please do me a favor and hit that subscribe button if you'd like to see more content like this. I definitely want to create more content in the future. Let me know some ideas that you'd like me to make videos about within the physical therapy realm, whether it's ankles, hips, shoulders. Give me an idea of what you'd like to see and what kind of content you'd like in the future. I appreciate all you guys for watching, and please be on the lookout for the next video within this individual series.